Hi everyone, I want to talk about clinical features of acute pharyngitis, otherwise known as sore throat. Sore throat or pharyngitis could be caused by bacteria, and in that case, I'm talking about group A Streptococcus pharyngitis. That is very common in adolescents or young adults. If that is the cause of the sore throat, there will be sudden onset, and the throat will be painful with fever. And when examination is done, we're going to find that the tonsils will be swollen and there could be exudates. And the pharynx will also be swollen and the uvula will be swollen as well. There's possibility of patchy tonsillar or pharyngeal exudates and anterior cervical lymphadenopathy. Scarlatiniform rash could be present, and there is likelihood of positive exposure history. If it is group C or group G streptococcus, that will be less common, but there will be associated fever, exudates, lymphadenopathy, rashes, and is also found in adolescents or young adults. It's common in waterborne or foodborne outbreak. So when there is tornado or hurricane and people are coming down with sore throat and it's pointing to bacteria, it's likely going to be group C or group G. Neisseria, gonorrhoeae, and chronic diphtheriae are both very rare. Mycoplasma pneumonia could be a culprit, or Chlamydia pneumoniae, Treponema pallidum, but they are all rare. If it is viral, the clinical features will be in such a way that it's a very common occurrence with cough, associated with fever, but the fever will be low grade. Malaise, that is feeling unwell. Nasal congestion. Coryza, that some call as catarrh or inflammation of the nasal mucosa. There is possibility of conjunctivitis with hoarseness, oral ulcers, and viral exudates. All the above is common in respiratory viruses. It could be caused by HIV virus, and that would be rare, but with acute retroviral syndrome, and that would be fever, fatigue, lymphadenopathy, that will be generalized, rashes, myalgias, that is muscle pain, arthralgias, joint pains, diarrhea, weight loss, painful mucocutaneous ulcers. Cytomegalovirus and Epstein-Barr virus are not left out. Epstein-Barr virus, as we all know, is responsible for infectious mononucleosis. And in that case, we're going to find fever, fatigue, cervical lymphadenopathy, splenomegaly, lymphocytosis that is seen in adolescent and young adults. If it's caused by herpes simplex, that will be very severe sore throat with or without ulceration. Pharyngitis could be complicated with airway obstruction, and if there is airway obstruction, there will be muffled hot potato voice, drooling of saliva, stridor, respiratory distress like tachypnea, dyspnea, and retractions. It's possibility of sneezing or tripod position with airway obstruction. Still on possible complications, we could have what we call deep neck space infection. And with that, we're going to have severe unilateral sore throat, bulging of the pharyngeal wall, bulging on the soft palate, bulging on the floor of the mouth, neck swelling and pain, torticollis due to muscle spasm, crepitus, trismus, neck stiffness, fever, rigor, and history of trauma. Still have complications. Other features in the deep neck space infections are quinsy, which is peritonsillar abscess, and that will present with severe unilateral sore throat, fever, ear pain, muffled voice, drooling, neck pain, neck swelling, trismus, bulging soft palate, and fluctuant tonsil. So mandibular abscess, which is with Weeks angina, will present with fever, rigors, mouth pain, drooling, dysphagia, neck stiffness, elevated floor of the mouth, crepitus, but no trismus. No trismus. Retropharyngeal abscess is also possible with severe sore throat. Dysphagia, positive history of penetrating trauma. Epiglottitis is also a possible complication with extremely severe or out of proportion throat pain. Could have fever with muffled voice, drooling, stridor, respiratory distress, and hoarseness. Repeat, epiglottitis is very possible with extremely severe or out of proportion throat pain. I'm re-emphasizing this because that is an acute emergency and we need to act fast. Parapharyngeal space infection, Lymph syndrome, or suppurative jugular thrombophlebotitis could also be present. And that will end the very presentation as far as the clinical features of sore throat or pharyngitis is concerned. And the next presentation will be on the diagnosis of sore throat or the diagnosis of pharyngitis. Thanks for listening to my presentation. Kindly subscribe so that you can get these presentations immediately they are published. Thank you.